even if you don't have full recovery of erectile function to have a natural erection, there are other ways that we can help you and your partner become sexually active. And that openness and that open discussion is very important. It's important to talk about side effects and what those risks of side effects are. Patients, when I see them, they used to always ask me now, what would you recommend for your father? Now they're starting to ask, what would you recommend for your brother? But it's a very personal decision. I think that in surgery, most men are really worried about incontinence. That is what I find most men are very worried about. The reality is men do very well with regard to incontinence. Most men recover full urinary control. The risk of incontinence is not zero, though. It's important to know that although it's a very small percentage, it's not zero. The other is sexual function. Either way, sexual function changes. So there's not only erections and erectile dysfunction, but also the fact that there's no ejaculate anymore. And with surgery, that happens immediately. With radiation, that happens gradually over time. The other thing I talk to men about with regard to erectile dysfunction is that engaging their partner and having an open mind. And what I have found is that the men who come in and they speak openly about it and they speak with their partner about it and have an open mind and speak together about it and openly with me, those are the men who have the best outcome, and not necessarily in terms of recovery of erections, but just the best outcome in being satisfied with their erectile dysfunction, or if they have dysfunction or their sexual function, because there are other methods we can use to get them sexually active. And I recommend that men, when they're going to their physician and going to that consultation about their options for prostate cancer, that their partner is there so that they can have an open discussion, think about not only the options, but what is the potential future for them together as a couple. That's very important. When I call a patient with the results of their prostate cancer biopsy, I tell them to go onto the internet and go to two places. One, our Cancer Center website, but also pcf.org, because I know that that is a resource where they can go and get good information about their options for prostate cancer, but also to understand what is prostate cancer.